Okay, the next and last option of treatment for ADHD is the non-stimulant medications. Non-stimulant medications, here we have three examples: Strattera, guanfacine, and clonidine, either the immediate release or the extended release, which actually the clonidine ER will be the star of the second half of this presentation. Next slide, please. Well, before we get into the second part of this presentation, let's just summarize what we talked about so far. We talked about ADHD definition, talked about characteristics of ADHD, talked about classifications of ADHD, talked about etiological factors that might contribute to ADHD, and also we talked about assessment and treatment options of ADHD. Now let's just focus more in depth into the role of clonidine ER in treatment of ADHD. This is a study was published by the American Association of Pediatrics in May 2011. And it looks more into the role of clonidine ER in treatment of ADHD. Next slide, please. Well, before we start talking about the clonidine ER, we have history of two small studies that were conducted for the role of clonidine immediate release in treatment of ADHD as a combination with stimulant. So this study we are about to discuss here is the first kind for discussing clonidine ER, extended release, as an add-on therapy for treatment of ADHD. Thank you. Next slide, please. Objective of the study. This study is to assess and evaluate the efficacy and safety of clonidine extended release tablet as add-on therapy for treatment of ADHD in children and adolescents with inadequate response to their stable stimulant regimen by itself. Next slide, please. The method. This study is randomized, double-blinded, placebo-controlled study. This study is designated for two kinds of ADHD. The first type is a combined type. The second type is the predominantly hyperactive subtype of ADHD. Also, in this case, patients were randomized to receive either clonidine ER in addition to stimulants versus the placebo in addition to stimulant. Next slide, please. ADHD was evaluated as baseline using the Katie-SAD Present and Lifetime Questionnaire 1.0 used by trained investigators. So these investigators started screening and evaluating the ADHD condition for each participant. The continuous reporting of symptoms for ADHD was done using the ADHD Reporting System 4, ADHD Reporting Scale 4, ADHD-RS4 was used. And you will always hear this part, ADHD-RS4, along the presentation. And the study was conducted in accordance with the Declaration of Helsinki and the Good Clinical Practice regulations. Next slide, please. Still talking about the method of this clinical trial. And here the efficacy measures was done by evaluating the improvement from the baseline to the 5th week. And the safety was assessed spontaneously by reporting any side effects, any adverse events, the vital signs, the electrocardiogram. All these were included to evaluate the safety of clonidine ER in treatment of ADHD. Next slide, please. Study design. So after we talked about the objective, we talked about the method. Now we talk about the study design. This study is 8-week parallel group randomized double-blind and placebo-controlled study. So it's a very well-established study here, actually. And this study was conducted in 22 centers nationwide, 22 centers all in the United States. And that happened between May 2008 and February 2009. So this is the duration of the presentation, or the duration of the clinical study, I'm sorry. Next slide, please. Study design. We have two main points here for the study design. We have the screening and the washout period. Screening was up to 2 weeks to assess and initiate dosing of each individual. The second part is washing out, where we had to eliminate all ADHD therapy before the study, with exception of methylphenidate and amphetamine-based treatment. Next slide, please. Inclusion criteria. For any design of a study or clinical trial, inclusion and exclusion is a very important parameter to evaluate the strength of this trial. So here, the inclusion criteria were included. The patient has to have ADHD RS4 score of 26 to be included in this study. Also, there was an intelligence quotient for this study that was processed by trained investigators, and the score required was above 80. These two important points regulate what kind of ADHD severity was included in the study. Next slide, please. Exclusion criteria. Okay, as we talked about inclusion criteria, exclusion criteria, what type of ADHD patients were excluded from this study? And here we see that current diagnosis of psychiatric problems, psychiatric disorder that require the patient to be on psychiatric or psychotropic drug, these patients were excluded from the trial. The second exclusion point here was severe comorbidity that might affect the assessment of clonidine efficacy and safety. Also, history of conduct. Also, we have history of seizure, except for febrile seizure. So patients with history of seizure were excluded from the trial. And also, we see intolerance of clonidine history. We are not going to give clonidine to someone who had serious allergic reaction or adverse events with clonidine. Also, patients have history of clonidine abuse, drug abuse will not be included in this trial. Next slide, please. Statistical analysis. Statistical analysis is very well established in this trial, as we will see here. Primary statistical efficacy analysis here used intention to treat as a very important parameter in this study. And defining intention to treat as any patient received 1 dose of therapy or provided 1 assessment during the study was included in the result of this study. This is very important here. Also, we see that the sample size was calculating use t-test, and the effective size of this study was set at 0.47 with a standard deviation of 7 to 15. That made us having a very important point of, for each 100 patient, the group will be included in order for this group to be statistically significant. Again, we have the effective size set at 0.47 and standard deviation of 7 to 15. That also created a two-sided alpha level of 0.05. And that means we have to have 100 patients in each group for this result to be significant. Next slide, please.